Adhesive capsulitis of the shoulder is a fairly common finding, and it can occur in a number of locations. We're going to look at the appearance of adhesive capsulitis on MR of the IGHL, or inferior glenohumeral ligament. And this is probably the more common one that we'll see on a daily reporting basis. The best sequence to see it on is the PD fat saturated scan, and the coronal plane is probably the easiest. What we're looking for is increased signal and thickening of the IGHL. So this is the capsule, which is formed by the IGHL. And what we see here is that we've got low signal IGHL, which should normally be low. This is a little bit thicker than usual, but it should normally be a low signal. But as we get to the more lateral portion of it, it's increased in signal, increased in size, so it's much thicker. And it's also very ill defined compared to the more medial aspect of the IGHL. So this is a fairly typical appearance of adhesive capsulitis involving the inferior glenohumeral ligament, where you'll get hyperintensity, ill definition, and thickening on MRI. One other feature which you can also look for in the more severe cases, you will see that inflammatory change spreading out into the adjacent soft tissue. So you can see that there's a thin rim of high signal that's tracking that, which is extrinsic to the capsule. One of the differentials is trauma. So trauma can give you exactly the same appearance. The way to differentiate that is really on the clinical history and whether you see any other features of trauma. Adhesive capsulitis, particularly of the inferior glenohumeral ligament, is a common finding on MRI. It's an easy diagnosis. It's just that you need to look at the inferior glenohumeral ligament and look for any evidence of thickening, hyperintensity, and ill definition.